you're in the right place. This is the Eatfluencer Podcast, and I'm your host, Dr. Maggie Landes. Together, we are going to unpack everything about eating and discover the what, when, and how that will let you lead your best life. This is not your doctor's conversation about nutrition. Today is when you can start to love eating again. Let food be food and you be you. Get ready to get eatfluenced. Hello and welcome to the Eatfluencer Podcast. I'm Maggie, your host here, and if you're new, welcome and thank you for joining me. I'm a physician and public health nutritionist who has now changed my entire career trajectory to be an anti-diet women's health coach. And I guide women fed up with their chronic dieting to adopt a mindset that is free from the restriction of diet culture. And the purpose of that is so that they will stop playing small in their own lives and achieve health without limits. So if that sounds intriguing to you, you are in the right place. And I want to welcome back all my regular listeners. You are now listening to episode 18, which is Health at Every Size, the Truth and Untruth. So the term health at every size may or may not even be one that you are familiar with. It's very much in the vernacular of the anti-diet movement and the people that are working in this section, but it may not be something that you've heard before. You'll see the abbreviation HAES, which is, pronounced HAES, but what that stands for is health at every size. It is not a diet. It is not a plan. It is a movement. It is a framework. It is an ideology. And the purpose of this episode today is to address some of the myths surrounding it, what it actually means, and point you in the right direction of maybe starting to adopt some of these principles, whether you are a person looking to escape the confines of diet culture, or whether you are seeking a healthcare team for yourself that will do the same, or maybe you are a healthcare provider. In any case, this is a conversation for everybody, and I certainly hope you enjoy our talk today. The first thing I want to point out is that the health at every size movement is actually a kind of a branded term, if you will. It was not invented by, but it was certainly promoted and really came into recognition after Dr. Lindo Bacon published her book that has the same title, Health at Every Size. In 2008, I believe, was the first edition of the book. But she has a PhD in physiology and weight regulation with graduate degrees in exercise physiology and psychology. So they're not a doctor in terms of being a medical doctor, but they certainly, if anyone is to understand the inner workings of the human body, Dr. Bacon would be the person. And not, like I said, it was not original. The idea did not originate with them, but certainly Dr. Bacon's work and the publishing of this book was a major sort of champion movement to get this idea closer to conversation, both in the lay people, chronic dieters, and also in health professionals. So I will recommend for certainly a good read and a way more deeper conversation and investigation than what we're doing today would be the book Health at Every Size, and you can get it on Amazon. I have mine right here. I think it's like less than $15. Really, besides the writing from Dr. Bacon, there is like pages and pages and pages with hundreds of scientific articles referenced in the book, so that you can then sort of go into that rabbit hole of investigation and figure out, where these concepts came from, where they originated from, and how they are truthfully proven in good scientific study. So that brings me to my first point, is that the HAES concepts are based in science. And this was a big turning point for me when I read this book and started really truly understanding health at every size. I am one who appreciates, innovative philosophy and people's ideas, but at the end of the day, I'm a science-minded person and a medical professional, and I was not about to change my belief system or my professional practice unless there was really evidence behind it. And reading this book and reviewing some of the evidence that's referenced here, there is science. And here, in a nutshell, is what the science says. It says the body works. The body is working all of the time. And the human body is a complex system of interactions that no person will ever completely understand. It is really beyond our comprehension to understand every single interaction in the human body. But what we do know is that the default condition of humans is health. The concept of homeostasis, or sort of self-regulating, feedback loops, is real, and the body knows what to do. And it's really just important that we recognize there's more to the inner workings of the human body than what we recognize. And that sounds sort of complex, but truly, the concept of health at every size is grounded in the belief that every human body is worthy, every human body has value, and that some degree of our interaction as people needs to recognize that value, independent of our health status, independent of weight, independent of ability level. The health at every size concept is really, sort of encircles the idea that humans by default are worthy. So let's go into health at every size, what it sort of means to me in my best interpretation that I can give to you. And I've got 4 sort of like bullet point ideas, and we'll unpack all those in a minute. I want to just first tell you what they are, and then we'll kind of circle back around to that. But the first main idea is that health is not defined by weight, period. That is a sentence. That's a complete sentence. There is not scientific evidence that is reliable and strong that demonstrates that either high weight limits life or that weight loss prolongs life. The size of your body is independent from your health and your risk from death, said another way. And said even another way is that poor health kills you and good health saves you. And in that comment, there is a complete decoupling from body size and weight. So that's the first point. The second point is that our body has this intricate, innate ability to regulate itself, including weight maintenance. And it will continue to do those things and fulfill those functions regardless of our ability to understand it, regardless of our desire to believe it or not, and regardless of our efforts to undermine it, frankly. So that is what I sort of referenced at the beginning, is that the body works. The body is designed to work, and the default condition of the human body is one of health. The third major point is that there is weight and body shape diversity in our population. that is how it is. And it's not in our power to control it, nor should we continue to make those efforts. And the fourth point is that when we marginalize people in large bodies and continue to propagate this narrative that weight loss is obligatory in order to attain health, and we go one step further to propose there's a moral imperative that all women subscribe to this belief system, we, and I mean healthcare providers or any individuals for that matter that is propagating this narrative, are doing a huge disservice that at best is discriminatory and at worst is frankly negligent, in my opinion. So we're going to go through in just a moment. I will go back to each of those four ideas and give you a little more explanation and a little more unpacking of those. But before we get into that, I think it's really important we mention what HAES, or health at every size, is not. Because, and I'll even be honest, when I first heard the term, it was sort of attached to a bunch of photographs of people in larger bodies. And I frankly didn't understand. I had not done any investigating or reading or anything. And I just didn't see if health is at every size, why this particular media messaging I saw only had large bodies. I was kind of confused by that. But what it is not is we are not saying that every size body is always healthy. We know that there are health conditions and preventable lifestyle associated disease at any and every size. So what we're saying is that it's equally possible to be healthy at every size or any size. But I used to, I kind of use the corollary of that too and say that it's also equally possible to be unhealthy at every or any size. So instead of just dividing people at large into two groups and saying there are lean, healthy people and fat or large, unhealthy people, we're missing at least half of the population because, yes, the lowest risk group in terms of developing chronic health conditions and having more chance of a long life, the sort of, quote, healthiest group of people are the lean and healthy people. So they're in smaller bodies, and what's going on inside of their bodies is healthy, meaning that their blood pressure is normal, their blood sugar is normal, their insulin sensitivity is normal, their metabolism is normal, that all that sort of inflammation is low. That's what I'm saying when I say healthy on the inside. And then the, sort of highest risk profile would be being in a large body and being unhealthy. And, those are, that's sort of the reputation that all large-bodied people receive, but that's not actually the case because there's two more groups of people. And frankly, this is where we need to focus our efforts. There is the large-bodied healthy people. So what I'm saying by that is people in larger bodies with fat on them. But if you measure any sort of real meaningful health metric like, coronary artery scores or, blood pressure, blood sugar, all those things I just mentioned, they're actually healthy on the inside. And those are the people that we are really speaking to when we say health at every size, is that these people are healthy and they are at least the same or even less risk of dying than the lean healthy people. So we need to stop, coupling and marrying the ideas of weight and health, because this group of people is not able to access the healthcare they need because of the weight stigmatization and the fat phobia that's built into our healthcare system. So there is a group of, like I said, large-bodied, healthy people. Okay. Now, on the flip side of that, there is a huge population of lean-bodied or small-bodied, unhealthy people. And this is pretty scary too, because the way that we have constructed our screening for health and how we have focused that on weight, this group of people is being entirely missed. If, they go to the doctor or they access care at some point and they're weighed, their BMI is, quote, normal, they, sort of like meet the societal norm, sometimes that's the end of the conversation, and there's no discussion about their own personal health promoting behaviors. There's no discussion about their mental health. There's no discussion about their relationship to food or body image, because it is presumed that if they are lean, they don't have any of those problems. So we're missing that group entirely with our current sort of screening. So that's one thing that HAES is not saying. We are not saying that every single, large-bodied person is healthy. What we are saying is it is possible to attain health in a large or small body, the same way that it is possible to be in a state of unhealth in any size body. Okay, another thing that HAES is not promoting obesity, and I'm doing quotes because that is just, there's so much there to unpack. I'm going to have to do a whole nother podcast episode about that. But people working in the anti-diet space, like myself, don't really like the word, quote, obesity, because by definition, when you say overweight or obesity, you're measuring that against a norm. The reason you can, sort of qualify a person or a body type as overweight or, quote, obese is because you're measuring against the norm. Well, we just discussed at the top of this conversation that there is body diversity. There is not a normal for everybody. So we're sort of applying, a metric way out of context. So all that to say, what we need to do is focus health and wellness practices on actual health and wellness. And when we continue to use weight as the proxy for health, we are totally misguided. We are not helping most people, and we may even possibly be harming some people and, marginalizing them from health promoting behavior. So that's one important thing. And I think now that I'm saying it out loud, I really probably will do another podcast about the language of the, quote, obesity epidemic, because that's a whole other deal. The last thing that I want to point out is that by supporting health at every size is not saying that eating is a complete free-for-all and that it doesn't matter what you eat. And this gets mixed up with intuitive eating a lot, because people think, oh, intuitive eating, you just eat whatever you want. All foods are equal and you can just eat whatever you want all the time and nothing bad will happen to you. No, that's not what I'm saying. That's not what anybody who's knowledgeable about the subject is saying. What we're saying is that your body knows what it needs. Your body operates properly. Your body is not broken, and your body knows how, when, and what you need to eat. So what our job is to understand how the body's trying to communicate that to us. And when we can cue into that and use our intuition, that's where the intuitive eating term comes from, we're going to be far more likely to attain health. So anyway, let's go back and talk about what HAES is, now that we've talked about what HAES is not. And like I said, these concepts are so important and so deep, and there is so much to be said that, frankly, every single one could be broken out into another whole conversation. But I'll try to make this succinct so that you can maybe get the full picture and at least be curious enough to do some more investigating on your own. But the first thing I brought up earlier was that health is not defined by weight. And, really when you get into the evidence, there is not good long-term results that show that weight loss is healthy or prolongs life, or that it's even possible to maintain. And, the interesting part is that the weight cycling, where you lose weight, gain weight, lose weight, gain weight, that's the clinical term for basically the yo-yo dieting behavior. We do know that has a very negative impact on health, independent of the absolute weight of the person. That it has a negative impact on self-esteem, on hypertension, diabetes, cardiovascular disease, psychological health. We know that weight stigmatization, which leads to lack of social connection, a feeling of isolation, those things do impact and limit our health capacity in our life. So I don't even have much else to say except for I want to read you this quote from a publication from the National Institute of Health, the NIH, and I'm just going to read it verbatim because they said it more clearly than I probably could. But when they were presenting data regarding weight loss diets, this is the quote. Most of the studies and the strongest scientific evidence show that pursuit of weight loss through restrictive dieting is strongly associated with increased risk of death by as much as several 100%, end quote. Interesting, right? Well, it's interesting, but the interesting part is that everybody kind of knows this. Even the diet industry knows this. That's why they stopped using the word diet, because they know that dieting doesn't work. And, finally, we are all coming around to the idea that dieting kind of has a bad rap. So, what have they done? The diet culture is a business model. I have to remind you that diet culture is not a clinical intervention or healthcare promotion. It is a business model. So in order for them to continue to do business, they have had to hijack all sorts of other words and weave that into their conversation, because the word diet doesn't sell anymore, because we have at least gotten that much through our brains. But now you have to really be careful, because diet industry and the diet culture start now using words like health and longevity and lifestyle and wellness and all these sort of cliche terms that they are morphing for their purposes into the promotion of weight loss diets. So buyer beware, and make sure that when you're getting, quote, wellness, promoting behaviors or lifestyle coaching, that you really understand what it is and whether or not that content is steeped in diet culture. Okay, so the second point, to open up a little bit, is that our body has the intrinsic ability to regulate itself and regulate weight, just the way that it regulates temperature and our growth and our, breathing and everything else. It's going to continue to do these things regardless of our ability to understand it, believe it, or what we do to try to either support it or work against it. It's happening all the time. Just as you sit here right now listening to me, as I sit here recording this for you, homeostasis in the human body works. And I'll spare you the details of going into a lot of nuanced molecular reactions and biochemical neurotransmitter response and all this sort of stuff. But suffice it to say that the human body is smarter than us. It is smarter than me. It is smarter than Dr. Bacon. It is smarter than any app, researcher, trainer, expert, doctor, program, plan, anything. We cannot either individually or collectively outsmart the exquisite design of the human body. And you can look at this any way you want. If you are a believer and you believe we are perfectly made in God's image, that is great. If you don't subscribe to that faith tenet and you just think it's a really good engineering system, either way it holds up. It has to be perfect, with just all the right feedback loops, with just all the right, sort of input and output, so that we survive as a species. That's how it works. So, you can understand how it works or not understand how it works, but it's working whether you do that investigation or not. So that's what Health at Every Size is saying, is that let's just let the body work and get out of the way, frankly. Okay, so now the third point is that there's weight diversity and body shape diversity in a population of people, and it is not in our power to control this. We we understand that people have different eye color or different hair color, different skin color, people are different heights. Like, we sort of just accept that there's some amount of diversity, but the diet culture messaging really negates that completely and is founded in sexism and racism and classism, and honestly, it promotes the belief that there's one perfect human form, and it happens to be a white, lean-bodied, able-bodied, privileged woman in perfect health. And that, the message to us as people is that we should be pursuing that perfect, quote, perfect human form at all expenses. And we're pretty much doing it. We spend, in the United States alone, $80 billion with a B dollars a year on weight loss, diets, weight loss surgery. I mean, we are hacking off parts of our body to try to attain this ideal. It is a total and complete sink of our time, energy, and financial resources. And to be honest, it is crippling us and limiting our potential. It's limiting our potential as individuals, and it's limiting our potential as a group of people. It is simply a distraction that culture has, put out there for us to fall prey to, so that we can be diverted from stepping into what we were meant to do. It is, I make the analogy all the time that it's like those governors on the U-Haul, that when you rent the U-Haul and they put the governor on the engine so that you can't go more than 65 or whatever, because I guess they think you'll wreck the U-Haul. It's the same idea. As long as we are playing into diet culture, our lives will be governed by it, and we will not be able to fully reach our potential when we continue to subscribe. So you can tell I'm very passionate about this, because this is just keeping women stuck. And it is my mission to help everybody, number one, realize that, and number two, get unstuck. So the fourth point that I want to mention is this marginalization of people in large bodies, that there's this fat phobia, weight stigmatization that happens in our healthcare system, in our society. And, when patients come to us, and I'm saying us as a doctor, as a healthcare provider, registered dietitian, clinical nutritionist, a therapist, whatever your part is in this conversation, when a patient comes to us, they are trusting us, and they are putting themselves in a position of receiving whatever we have to give them. That's how it works. They are seeking care. That's why we call it seeking care. We have an obligation to give them, if nothing else, dignity, respect, evidence-based solutions, and empathy. And then, once we've given them those four things, we can give them advice. We can give them a care plan. We can give them a prescription. We can give them a follow-up appointment. But all of that will not matter if you don't give them those first four things: dignity, respect, evidence-based solutions, and empathy. And if we don't give them those fundamental things, we are going to drive them away from the system altogether, and they won't get anything. And we do know that that is bad for health. And it is far worse for their health to not access any care than it is, any detriment of their body size that we are perceiving to be a problem. We really need to remember the oath we took to do no harm first. And this means a lot to me. So I want you to consider that. If you're listening to this and you're in a position of authority, taking care of patients or clients, that you remember the reason they're coming. They're coming to seek care, and that's what we owe them, and that's what we should be focusing on. So this is becoming longer than I intended it for it to be, but there's so much to talk about. And this, frankly, is just the airplane level 30,000 foot view of what health at every size represents. It's not a set of rules. It is a mission. And I hope that this has been eye-opening to you in some way, and that you can at least approach the concept with curiosity and open-mindedness. Start thinking about how you might consider some of these tenets and how you could potentially adopt some of this mindset, because you deserve better. Everyone deserves better. And I would recommend, certainly a good place to start is reading the book, which is titled Health at Every Size by Dr. Bacon. You have a part in this conversation, whether you are in the healthcare sector or not. This is totally something that affects every single person in our culture. So I'm very grateful you have given me the 30 minutes today to listen to this episode, and I would be so humbled if you share this important message, because like I said, it is more than a message, it is a mission. Thank you so much. So if you have liked this conversation or other conversations we've had on this podcast, the Eatfluencer podcast, please leave a rating or review on your podcast platform. That really helps people find this content. The algorithm sort of moves this up the search engine ladder so that people are able to access these important conversations. I also want to let you know that I run a group coaching program, and my next group cohort will be starting March 1st. So if you're listening to this in real time, it is the first week of February that you can jump over to my website, get on the wait list, and we'll be notified. You'll be notified when the enrollment for that March group coaching opens on February 22nd. So everything can be found at maggielandesmd.com. All right. Thank you so much for continuing this conversation, and however you wish to connect with me. I hope you'll tune in again. I have a new episode every Wednesday. So thanks for joining me. Until next time. Thank you so much for being here today. If you love what you've learned, follow me on social media at Maggie Landes MD, and you'll never miss a thing. You can also check out my website at maggielandesmd.com and sign up to be part of our community of eaters. Thanks again for stopping by. We'll talk again soon.